Good day. This is informational speech entitled COVID-19 and Women's Empowerment. The COVID-19 crisis deeply impacts women, men, boys, and other genders differently. While men make up the majority of those who have died from the virus, women and girls bear the brunt of disproportionate care burdens, disruptions in income and education, poor access to health and other essential services, greater risks of being exposed to their economic stability, and overall the ability to purchase critical necessities such as medicine and food. The COVID-19 crisis will have significant implications for U.S. investment in global women's economic empowerment, including the Women's Global Development and Prosperity or W2GDP initiative, the Development Finance Corporation 2x Women's Initiative, and U.S. investment in the Women's Entrepreneurs Financing Initiative. The gender and social norm manifestations of COVID-19 present an urgent need for governments, businesses, community leaders, and decision makers to act. Women's employment in the health sector disproportionately exposes them to COVID-19. Women comprise about 70% of global healthcare workers and are front of center to exposure to COVID-19 and stigma within their communities for working near COVID patients. Additionally, the gender pay gap in global health workforce is 11%. Lower payments decrease ability to purchase necessary supplies or access care. The undervaluing of women's work hurts women and healthcare systems and underinvestment hold systems from back preparedness in times of crisis. Unemployment and women's overrepresentation in the informal sector heightens their vulnerabilities during crisis. The International Labour Organization estimates that 195 million jobs could be eliminated globally due to pandemic, with a majority in sectors predominated by women. Furthermore, over 740 million women around the world work in the informal sector and as low-wage workers. Employment that is vulnerable to elimination due to COVID-19 and which often lacks protections against exploitation and harassment. Migrant women working in non-essential service industries such as food service, hospitality, and domestic workers in predominantly childcare are particularly vulnerable to being laid off or exploited for their labor during COVID-19. Furthermore, the 26% gender gap in labor force participation now seems to be widening further, and the U.S. Department of Labor reported in April 2020 that women held 60% of 700K jobs that have been eliminated in the U.S. so far due to COVID-19. Women and adolescent girls take and disproportionate care burdens with negative impacts in their economic empowerment. Due to social norms, women already perform 76.2% of the total hours of unpaid care work, more than 3 times of as much as men. During public health crises such as COVID-19, care burdens dramatically increase to include caring for the sick, vulnerable elderly family members, and children whose home due to school closures. This is not only exposes women and girls to contracting the virus from infected family members and also reduces time spent on generating an income, operating a business, or other economic activity. Again, this is Jezruba, your speaker in informational speech entitled COVID-19 and Women's Empowerment.